Good morning, friends. I hope you are keeping well, and Lord Dhanvantari has blessed you with all the required health. And of course, all of you know that November 21 is celebrated as World Piles Day. So I thought that let me share a little bit knowledge what I have got, I achieved by my clinical practice in the last 20 years. So day one today is think the Arsha. Okay, the piles are usually popularly known as Arsha in Ayurveda, and most of the time we make a diagnosis of Arsha by means of clinical examination as per the piles, and then we treat it accordingly. And most of the time, popularly we treat with the Kshar Sutra ligation or Kshara Karma, which is keep what which is now getting its momentum, and of course the piles excision, that is hemorrhoidectomy, which is commonly practiced. But my question is whether Arsha is so simple that piles should be considered and accordingly should be treated, because Arsha is considered under one of the Ashtamahagada, isn't it? So when it is considered Ashtamahagada, then is it so easy that only by hemorrhoidectomy will get rid of the Arsha or the piles? Of course, piles will get rid of the by will get rid of piles by means of excision. Of course, complications are there. The certain conditions are there where mere pyrectomy will not help. But still, most of the 99% of the time, when it is purely diagnosed as a piles, can be get rid of or can be treated, managed well by means of hemorrhoidectomy. It is indicated. But why our Sushruta, Acharya Sushruta has considered Arsha as the Ashtamahagada? So, as per my opinion or at my understanding, I may be wrong, but I believe that most of the clinical practitioners of Ayurveda, they they agree with me that Arsha cannot be only piles. Piles can be Arsha, but Arsha cannot be only piles. Arsha is what I believe all the neural conditions where the fleshy growth is noted. So it can be the other conditions like rectal polyp, it can be the carcinoma conditions of the anus, rectum, is it? And even inflammatory conditions, inflammatory carcinoma from the adjacent organs can be what you call categorized under the Arsha. And then if you think in that aspect, then it is easy for us to accept Arsha as one of the Ashtamahagada. And of course, the pathology, when you go to the pathology Samprapti, the Arsha basically starts at the Amashaya and Pakwashaya. So it is both Amashaya Samutta and Pakwashaya Samutta Vyadi. And because of that, the treatment, local treatment or Vyadi Pratyanika Chikitsa, considering Arsha as piles, may not be sufficient. That's why many times patients come with the other associated complaints even after the hemorrhoidectomy. So it is a thought what I wanted to share. When Arsha is considered Arivat, Pranashanotiti Arsha, like animate, what you call disturbs, or it gives pain. Not only pain, it almost like it may complicate the life when it is considered as the carcinoma conditions of the rectum and anus. Then we are supposed to look the deeper aspects of the Arsha rather than only treating it as piles. So this is purely my opinion, and I will invite the discussion on this, and I'll be blessed if any of my senior colleagues who are in the loop, who are in my friend circle in the Facebook, as well as the YouTube, the LinkedIn profile connection, so can give their opinion and enhance the what you call the Arshak concepts in a more deeper way. Then we'll be able to give or make the World Pies Day more, we can celebrate it in a more better way, and thoughts can be exchanged, and accordingly our junior doctors, the Ayurvedic surgeons, can treat the Arsha in a better way. Because see, Arsha, the concepts of the other pathological samprapti in detail I'll be sharing in the next video. So I am limiting my videos to as a micro video. Actually 3 minutes, in 3 minutes I was supposed to complete, but of course it has took almost 6 minutes. So today the thought is Arsha cannot be only piles. Arsha, all the fleshly growths which may be appearing in the any part of the what you call the canals of the human body. Of course, Nasa Arsha is discussed, and Yoni Arsha is discussed. But considering the Arsha for Ayurvedic surgeons, especially Shelly people, we more focus on the anatomical condition. So, Arsha, as per my condition, as per my opinion, is anorectal, all the growth, the pathologies which may lead to growth. So, I hope this will give some what you call it, generate some thought, and it will generate some curiosity, and it will generate some wider aspect in your mind, and you can go through this samprapti in a detail, and you will be focusing on the main what you call the other three treatment modalities: Beshaja, Shastra, and Beshaja, Kshara, and Agni. Of course, Shastra is usually practiced. So, place your opinion in the comment box so that a better conclusion can be arrived. Thank you and have a good day. Bye bye.